My name is Dr. Cynthia Chan. I'm a chiropractor and a co-owner of King West Chiropractic. Today I'm going to explain a bit about how chiropractic works, the technique we use for chiropractic adjustments at this clinic, and some of the tests that we would use on patients to determine where the adjustments take place. All chiropractors have the same goal, to find areas in the spine that are restricted and that could be causing pain. A spinal joint that's in pain and stuck can be caused from emotional, physical, and chemical trauma or stress. A successful adjustment, you want to move the joint that's stuck, tell the brain to heal that area faster, and send messages to the muscles that are guarding or spasming around that joint. The technique that we use at this clinic is called activator. This is an activator adjusting instrument. It delivers a safe, low-force, specific adjustment to the spine. The adjustment sends a specific force into the joint to move the joint in the direction it's not moving. During the adjustment, there's little receptors in the joint that tell the brain to heal that area faster. It tells the muscles around it to relax, and it gets the joint moving smoothly again. For the activator protocol, there are specific tests for lower body, pelvis, low back, mid-back, and neck that we do on every patient to try to find all the areas in the spine that may be restricted and pulling the body out of alignment. The goal of every activator adjustment is to balance out patients' leg lengths. If you have one leg shorter than the other when you're lying down, it's a sign to us that you're out of alignment. And usually it's not because the one leg is actually shorter than the left, or the right is actually shorter than the left. It's because your body's restricted at certain areas, pulling the body short on that particular side. The first step is to observe Dr. Lyon's legs to see which one is pulling short. She's presenting with her left leg short today. And again, to clarify, it's not that she actually has a shorter left leg on this side compared to the right. Most likely there's some restrictions happening in her pelvis and spine that's pulling that side short. This is the second position we observe in, which helps give us more information about how to proceed with the adjustments. I'm going to start off by checking her knees. If she needed a knee adjustment, I can make a contact on the inside of her knee. For the purpose of the video, I'm just going to adjust on top of my finger, but usually we would make contact with the joint itself. The next step is to check her pelvis. Now this is really important because many patients come in saying their hip hurts in this area. And usually it's not their actual hip that's sore, but it's their pelvic or sacroiliac joint that's sore. I'm checking that now on the right side. If she needed her right sacroiliac joint adjusted, I would do it using these three contacts. 1, 2, and 3. Those three contacts moved the sacroiliac joint back. If her joint was stuck forward, if her joint was stuck back and I needed to move forward, I could do 3 different contacts. Now I'm going to go ahead and check her lumbar spine. The pelvic adjustments balanced out her legs, and now for every subsequent test, we're looking for shortening. If the body has a reaction and shortens on a particular side, we know that joint needs to be adjusted. Bring your right hand behind your low back. This is a test for lumbar 4, which is the 4th vertebrae in your low back. Again, a very common area that gets restricted when people have low back pain. Hand down. If she needed her L4 adjusted, I would make contact here. Both hands behind your low back. The last test I'm showing is lumbar 2. That balanced out fine. There were no changes in her leg lengths. Then we assume that that joint is moving well, and we move on to the next test. Today you've learned a bit about how chiropractic works, the type of technique we use at our clinic, some of the tests that we would use to check lower body, pelvis, and lumbar spine, the low back.